let's return to the ongoing story of the Channel migrant crossings. Now, of course, we did see some claims and counterclaims yesterday from the Prime Minister and Labour about how they were coping with the backlog of, what's it called, legacy asylum applications. But we also saw stats that showed that actually the number of Channel crossings from migrants from France had actually fallen in 2023 compared to 2022, although still sky high. But now it appears that Channel migrant crossings could hit 35,000 this year, going up again, despite Rishi Sunak's pledge to stop the boats by the next election. That's according to leaked Border Force documents. Well, joining me right now to discuss this and plenty of other stories is Sir Geoffrey Clifton-Brown, Conservative MP for the Cotswolds. Hello, Sir Geoffrey.
Good morning, Julia.
Good morning and Happy New Year to you. I mean,
Happy New Year to you.
I'd love to have a day ever on my show where, for some reason, we didn't have to discuss the Channel migrant issue. But new stats, new information comes out all the time. You get a bit of a good news story, yay, figures have gone down, and then you discover no, apparently the Border Force is just planning for more people to come next year than this year than last year. I mean, what is going on?
Well, the simple fact is that the push factor, the number of people who want to come here, is getting greater and greater. And therefore, our measures to stop it happening need to get stronger and stronger, which is why we are trying to do a variety of things. We have paid France a significant amount of money, and that's deterred some people coming across. We've had this returns agreement with Albania, which has sent 90% of the Albanians back. And we are now trying to get the Rwanda bill through Parliament in order to deter more people from coming. But as you say, and your clips there are showing, very large numbers of people want to come to this country. And it's a problem not just for us, it's a problem for Italy, Germany, Greece, all sorts of frontline
Well, it is a big problem
countries.
for those countries, but actually one of the reasons why Border Force reckon we're going to see an increase again is because so many more people have arrived in those countries, and they often perhaps don't provide such a... I mean, I know people don't think that the Bibi Stockholm or many of the hotels we're putting our asylum seekers in, or Channel migrant arrivals in, but they're better than what they're getting offered in France or Italy or elsewhere. But this is the thing. I mean, the Prime Minister said, judge me on 5 things. His 5 pledges when he became Prime Minister in January last year. Very clear. One of them was stop the boats. He stood in front of a podium saying stop the boats 1,000 times. But we had 46,000 small boat crossings in 2022, down to below 30,000 in 2023, and it's now going to go up again to 35,000 this year. It suggests to me that it doesn't matter what we do, we're not going to stop this problem. We're just stuck with this problem forever.
Well, we're, Julia, talking about the predicted number next year. The actual number this year has reduced by 30% because of the measures that I've been taking. So let's claim some success for what we've actually achieved and then work on the future through Rwanda and other measures to see how we can reduce it further. But this prediction is based on the fact that more people want to come here. Therefore, as I say, we've got to take more measures to stop it.
Maybe we should... I think the solution to the Channel migrant crossings is that we should publicise how rubbish things are in this country quite all the time. I love Britain. I think I live in the best country in the world, but not many things work here in terms of, a lot of, problems with our healthcare system, our, housing, our education, social care, all of that. Maybe we should publicise we're a bit rubbish. Stay in France, it's probably better there. Maybe that should be the next campaign.
Well, I don't ever believe in talking this country down, I have to say. And if you live in some of the darkest African countries, I'm not going to name them because I shall get categorised by using that phrase. But, I mean, quite honestly, what they have to live in is so much worse than what we've got that anybody will have a very, very big incentive to try to come to this country. Just to name a few, English language, they probably get taught in schools, free health service, free benefits, all sorts of things they get in this country, which are hugely better than what they've got. And therefore, the incentive to come here is enormous.
Yeah, I mean, and that's the thing. We're not going to stop those incentives. There's also talk about, you mentioned the Rwanda bill. We haven't got a date yet for that returning to Parliament. And again, whether or not those planes ever take off, who knows? And if and when they do take off, Whether that's going to have a deterrent effect when it's going to be a handful of people realistically, maybe a few hundred if we're lucky, I do wonder whether that would work. But there are claims today, Home Office figures revealing, that, well, sorry, last night, more than 33,000 migrants face deportation to Rwanda if flights get off the ground. These are the 33,000 whose applications have been lodged since the Stop the Boats legislation became law in July. Those are the people who are eligible for it. Realistically, I mean, it's going to be closer to 33 than 33,000, isn't it? It's a nonsense. This Rwanda policy is so much energy is going into it, but it's not actually going to solve the issue.
No, but as I was saying earlier, we have to try every measure, and that's returns agreement with the Albanians. It's negotiating better agreements with the French, maybe the Turkish and other countries to help. But Rwanda is one part of the armory, and it doesn't need too many people if we can make it work, if we can get the bill through Parliament and make it work, to act as a significant deterrent. Because if you are an economic migrant, and this is what we're talking about, economic migrants are very different from refugees who are fleeing persecution, fear of their lives. So the economic migrants would think twice about paying an illegal boat handler several £1,000s to get on a very dangerous boat trip across the channel. So I think it's just one part of our armory, and we'll have to see whether we can get it through Parliament and then whether it survives any judicial...
We shall see. Before I let you go, I want to ask you about the other major story today, of course, which is the NHS doctors' strike. Junior doctors on strike 6 days, busiest week of the year for the NHS, permanently in crisis these days. I'm asking our audience today, is it immoral for junior doctors to strike in this week of all weeks when there's so much pressure on the NHS in early January? Do you think it's immoral?
Well, the Telegraph has got a very interesting article this morning, and I'm just looking at my notes so I get the figures correct. They're saying last year we had 53,000 excess deaths. The number of appointments and operation cancelled due to junior doctor strikes is 1 million. More than 200,000 cancellations are prompting warnings that action is making it harder to bring down the waiting list. Now, these are very clear figures that are proving that the junior doctors' actions are actually harming patients, and in some cases, I regret to say, actually causing deaths. And when you think that when my sister went into the health service to become a GP, she signed the Hippocratic Oath, which all GPs have signed, junior doctors have signed, to do the best they possibly can for their patients. I can't see going on strike for 6 days, immediately the new year starts, is actually honouring that oath.
Do they still have a right to strike, if just not this week?
They have a right to strike, but they also have 6 days on the trot is deliberately designed to sabotage proper treatment in the NHS. And when you think they're going on strike for a 35% pay increase, this is blatantly political. It's damaging the health service, it's damaging patients, and it's about time the junior doctors started seeing reality, I think.
Isn't it also about time that the Health Secretary got round the table with BMA leaders and came to some sort of deal? They've done deals with everybody else.
Well, to be fair, she has tried to get round the table. I think the government's offer at the moment is 11% over 2 years. The junior doctors in Scotland have settled at that level. So there's no reason, except for political damage, that the junior doctors shouldn't settle at that level in England.
All right. So, Geoffrey Clifton-Brown, really appreciate you joining us there, MP for the Cotswolds. Thank you for that.